Hi, ladies. It's Dr. Sherble. I hope that everybody had a good Mother's Day. This month is Preeclampsia Awareness Month, and I wanted to take that as an opportunity to explain and talk a little bit about preeclampsia. Just this month, I have delivered 3 women who have had preeclampsia at 3 different hospitals. So, a little plug, I want to mention, people ask me this a lot because I'm in private practice. And by that, I mean I own my practice, which means I'm not employed by any hospital or health system. And I have privileges, which means I can deliver and operate at St. Luke's in Chesterfield and Missouri Baptist and Mercy Hospital in St. Louis. So I go to St. Luke's and MoBAP and Mercy Hospital all in St. Louis, and I deliver babies and operate at all 3 of these facilities. So if you ever have questions about them, don't hesitate to call, but I'm happy to utilize all of their services. Let's talk about preeclampsia. So you may or may not have heard of it, but basically preeclampsia is a condition that causes a woman's blood pressure to be really high at the end of pregnancy. So if you haven't heard that term preeclampsia, you might have heard of gestational, which means pregnancy hypertension. Sometimes we say preeclampsia, sometimes we say severe preeclampsia or preeclampsia with severe features, and all of that can lead into this terrible thing called eclampsia, which is what we're trying to avoid. But for this talk, I'm basically just going to use the term preeclampsia, and I'm going to kind of encompass all of that because it's all the same disease. It just gets worse as the pregnancy progresses. So this is, like I said, this is what you hear about when you hear about women getting high blood pressure at the end and it becomes kind of dangerous and the doctor recommends delivery. Okay. What is preeclampsia? What happens to the woman? So preeclampsia is a disease that comes from the placenta. So the hormones from the placenta that are circulating in the bloodstream, usually in the 3rd trimester, rarely in the 2nd trimester, but it can happen in the 2nd trimester. Usually it's in the 3rd trimester. And those circulating hormones can cause a mother to be very sick. And the easiest way to understand what's happening to her is if you can consider that her blood vessels are kind of being insulted by inflammation. And so she's inflamed. And so because her blood vessels are inflamed, they're a little bit leaky is the term that I would use to put in layman's terms. They're a little bit leaky. But what I mean by that is she starts to swell. The plasma doesn't stay in her intravascular spaces as much. It swells. So we know that pregnant women have swollen ankles and swollen feet and swollen legs. They complain of carpal tunnel because they've got swollen wrists. So that's all, unfortunately, a common part of the pregnancy glow is how I say it. But women with preeclampsia have more severe swelling. And that swelling can turn into swelling in the lungs, swelling in the brain, swelling in the liver. And eventually it could lead to a mother having a very, very high blood pressure, which could cause her to have strokes. It could lead her to have eclampsia, which means a seizure due to a swollen brain. It could mean that the placenta is kind of bad, is how I would summarize it, and we have a really little baby. Or it could be that the baby demises because the placenta can detach from the uterine wall, which is called placental abruption. So these are the main big things that we worry about. So we have 2 patients to worry about. We have to worry about mom, and we have to worry about baby. So when I diagnose a woman with preeclampsia, especially if she's early, it can be really upsetting, this idea that we'd be delivering a baby early, knowing that this baby is going to have to go to the NICU for a couple weeks or maybe even more sometimes. But the point is we're doing it because if we don't, we're very concerned that mama is going to have a stroke or a seizure, and it's a really bad seizure, a really, really bad seizure, or that the placenta could detach and the baby could be a stillborn. So the sequelae can be very, very serious if it's not treated. So I think it helps if we just understand this pathophysiology that preeclampsia is something that comes from the placenta. It's the circulating hormones. To cure this sick woman, and I will say to the patients, like, you are sick, to remind us all that even though we're having a baby and it's a birthday party, it's joyful, it's a very serious time in her life because she is very sick. And to remind her that she is sick and we have to deliver the placenta. So in order to deliver the placenta, which is making her sick, we have to get this baby out. So if that were to come up, the doctor would recommend delivery depending on how severe it is. So you might watch it for a little while if it's not so severe, but then if it gets to a certain threshold, that's why we go to school. We learn who's more serious than others and when's the appropriate time to deliver the babies, keeping in mind that they might be premature versus the risk of the mom if we don't deliver the babies. So for those of you who are pregnant or thinking about becoming pregnant, there's a couple things that there's one main thing that we could do to try to prevent or lessen our chances of preeclampsia, and that is to take an 81 milligram aspirin every day. So we say baby aspirin. It's not because we're pregnant. It means it's just because it's a little dose of aspirin, 81 milligrams. But if you take an 81 milligram aspirin daily, it significantly reduces the chances that you're going to develop preeclampsia in the third trimester, or maybe you would get it, but it wouldn't be as severe. So it makes it less intense. So some patients even take 2 81 milligram aspirins a day. Some patients don't ever take it. So it's not necessarily that everybody should take it, but it certainly warrants a discussion. I do think every pregnant woman should have a discussion with her obstetrician about if she should be taking an 81 milligram aspirin to prevent preeclampsia. And if you're pregnant and you haven't had that conversation with your doctor, I highly recommend, no matter where you are in your pregnancy, to ask your doctor about this. And there might be reasons the doctor would recommend it or not recommend it, but it certainly warrants a discussion. And the other thing to impart would just be that in the third trimester, if you were to start to get a severe headache or blurry vision, isn't relieved with Tylenol, that could be a sign that maybe there's something worse going on and you should call the doctor. Also, chest pain and trouble breathing. All pregnant women have some degree of the sensation of shortness of breath, but if it gets significantly worse in the third trimester, that's a reason to call the doctor. Also, if you have abdominal pain, kind of an upper abdominal pain, I always kind of go like this, like up here. It's almost sternal, but that can be a sign that the liver is swollen. So these would all be signs that you should call your doctor and maybe get your blood pressure checked and be evaluated for preeclampsia. It's most commonly a disease of first-time moms and young moms, but it certainly can happen in second, third, and fourth subsequent pregnancies. It doesn't only happen to first-time moms, and it doesn't only happen to young moms. It certainly happens to older moms. Other risk factors include if you have hypertension, if you have diabetes, if you have kidney disease, if you have twins, that's 2 placentas. If you have triplets, that's 3 placentas. So any comorbidities that involve the vascular system, such as hypertension, diabetes, or anytime you have more placenta, you're at an increased risk of developing preeclampsia. And it's something that me, Dr. Sherbel, I'm a little bit paranoid about preeclampsia. I talk to every patient about it at the first visit. I talk to every patient about it at every visit starting the third trimester. And if the blood pressure jumps a significant amount, even the second trimester, it's something that I always talk to the patients about because unfortunately it's really common. So I hope this has been helpful to those of you who are my patients. If you have any questions, please call. And then hopefully you share this knowledge with your family and friends because unfortunately it can lead to very bad outcomes, and it's good for all women to be educated about preeclampsia. So I am Dr. Sherbel. I work at Sherbel Clinic. We give superior care. Come see me. I hope you guys have a good May. Talk soon.